What to expect when you go for a transvaginal ultrasound. So your healthcare professional has ordered a transvaginal ultrasound for you, and now you're going to go to a diagnostic facility, a place where they do x-rays and CAT scans and MRIs and ultrasounds and mammograms to get a transvaginal ultrasound. A lot of times, if you're having an ultrasound where they're going to look through the vagina, the probe is going to be placed through the vagina. You will go into the room, they will discuss with you what to expect. You will be asked to get undressed from the waist down. The technician will then come into the room, sometimes with a chaperone, sometimes without, depending on the facility, and then they will ask you to go into the stirrups, and then they will place the probe inside the vagina to get a really good, clear imaging and really good, clear pictures of the uterus with ultrasound technology. Sometimes they might do a transvaginal ultrasound with an abdominal ultrasound or transabdominal ultrasound, and this generally means they will use the probe through the vagina and they will use the probe through the abdomen too. Sometimes see a little bit better and a little bit more clearly with a transvaginal ultrasound, which is why this can sometimes be indicated and why sometimes it's a good idea, if you're comfortable with it, to go with the transvaginal ultrasound over the transabdominal, because sometimes you might go for a transabdominal through the abdomen and not get clear enough pictures and then end up having to go back. If you're feeling uncomfortable, you can ask to take the probe and insert the probe yourself. So for some women, this is a really good option if you have a lot of discomfort with these types of exams, or you can ask to place your hand on top of the technician's hand to kind of guide them and go at a speed and a rate that's comfortable for you. Most of the time when you go for a transvaginal ultrasound, they will want you to go in the beginning of your menstrual cycle. So during the follicular phase of your menstrual cycle before ovulation. Sometimes they get really specific and they want it to be something like day 5 to day 10. And this is because you've done bleeding with your menses and you're not quite building the lining up of the endometrium that you do in the luteal phase of the menstrual cycle. And so it's really easier and clearer to see what's going on within the uterine cavity when you have your transvaginal ultrasound done in the beginning of your menstrual cycle. So just make sure that you ask them if they want you to go at a specific time, and if you want to get really good, clear pictures so you don't end up having to go back. That's a great time to get really good pictures, and it's also a good thing to do to ask for the transvaginal ultrasound if you're comfortable with that, in addition to a transabdominal, so you don't have to go back and get additional pictures.